Um, um, yeah, explain to me again alpha intercalated cells and beta intercalated cells, just kind of in a few words each. So alpha secrete acid and beta secrete bicarbonate. Okay.
All right. Yo, we were just summing up alpha and beta intercalated cells. Alpha intercalated cells secrete hydrogen ions to fight acidemia, pumping H plus into urine and making bicarbonate for blood. Beta intercalated cells secrete bicarbonate into urine during alkalemia, reabsorbing H plus to lower blood pH. Want to dig deeper or switch topics?
Let's talk about
Yo,
treatment of
yo,
acidosis. So, treatment of respiratory and metabolic acidosis. So, yeah.
All right, let's dive into treating respiratory and metabolic acidosis. For respiratory acidosis, caused by high CO2 from poor lung function, the goal is to improve ventilation. This can mean oxygen therapy, non invasive ventilation like CPAP, or mechanical ventilation in severe cases, alongside treating the underlying issue like COPD or pneumonia. For metabolic acidosis, caused by excess H plus or low bicarbonate, treatment depends on the cause. If it's from diabetes ketoacidosis, insulin and fluids are key. For lactic acidosis, address the source, like shock, with fluids and oxygen. Bicarbonate therapy is used sparingly for severe cases, like pH below 7.1, to avoid overcorrection. Kidneys help by boosting H plus excretion and bicarbonate reabsorption, especially in chronic cases. Always tackle the root cause first. Want to focus on a specific treatment or acid base disorder?
Uh-huh.
All right.
And so, how the body responds in respiratory alkalosis, acidosis, and metabolic ones?
All right, let's break down how the body responds to respiratory and metabolic acidosis and alkalosis. In respiratory acidosis, high CO2, low pH from poor lung function, the kidneys compensate by increasing hydrogen ion H plus excretion and reabsorbing more bicarbonate HCO3 minus in the proximal tubule and collecting duct, raising blood pH over hours to days. For respiratory alkalosis, low CO2, high pH from hyperventilation, kidneys reduce H plus excretion and excrete more HCO3 minus, lowering blood pH to normalize it. In metabolic acidosis, low HCO3 minus or high H plus, low pH, like in ketoacidosis, lungs hyperventilate to blow off CO2, reducing H plus and raising pH fast, while kidneys ramp up H plus excretion via alpha intercalated cells and generate HCO3 minus. For metabolic alkalosis, high HCO3 minus, high pH, like from vomiting, lungs slow breathing to retain CO2, increasing H plus, and kidneys excrete excess HCO3 minus via beta intercalated cells. Each response aims to restore pH to 7.35, 7.45, with lungs acting quickly and kidneys taking longer. Want to dive into one condition or treatment specifics?
I wanna ask you about treatment of alkalosis, metabolic and respiratory. So, what about electrolyte giving metabolic or breathing in a paper bag? Explain why we do this in each case.
All right, let's dive into treating metabolic and respiratory alkalosis. For metabolic alkalosis, where high bicarbonate, HCO3 minus, spikes blood pH, treatment focuses on the cause, like vomiting or diuretic use. Electrolyte replacement, such as potassium chloride or sodium chloride, corrects deficits and boosts renal HCO3 minus excretion, lowering pH. Acetazolamide, a diuretic, can also force HCO3 minus loss in urine. This works because replacing ions like chloride helps the kidneys.
Tell me more, dude.
All right, let's finish up the treatments for metabolic and respiratory alkalosis. For metabolic alkalosis, with high bicarbonate jacking up pH, you fix the root cause, like puking or diuretics, and give electrolytes like potassium or sodium chloride to replace losses and push kidneys to dump extra HCO3, bringing pH down. Sometimes, acetosalimate is used to speed up HCO3 excretion for respiratory alkalosis, where hyperventilation drops CO2 and spikes pH. Breathing into a paper bag works by trapping CO2, so you rebreathe it, raising blood CO2 to lower pH fast. Treating the trigger, like anxiety or fever, is key too. Want to dig into one treatment more, or wrap with something else?
Still don't understand this paper bag thing. So is it basically to...
No worries.
Tell me.
All right, let's nail down the paper bag thing for respiratory alkalosis. When you hyperventilate, you blow off too much CO2, making blood pH rise, too alkaline. Breathing into a paper bag traps the CO2 you exhale, so you inhale it back, raising CO2 levels in your blood. This lowers pH closer to normal, fast. It's a quick fix while you address the cause, like anxiety or pain. Want me to explain it another way or move on?
Yes, please, do.
All right, let's break down the paper bag trick for respiratory alkalosis again. Super simple. When you hyperventilate, you lose too much carbon dioxide, CO2, which makes your blood too alkaline, raising pH. Breathing into a paper bag lets you rebreathe the CO2 you exhale, putting it back into your system. This bumps up CO2 in your blood, which brings pH back toward normal.
I see.
It's like...
Got it. Alright. Well, this is the end of the episode. Thank you for watching.